Let's give a massive Birmingham convention round of applause to Mark Ledoux.
And it feels like you're drowning, pulling against the stream, pulling against the wave after wave.
Nice to be in England. Nice to leave New England for Old England. It's been really cold in my neck of the woods. Beautiful sunny day here in England. Not so sure what it's like in my farm in Hollis, New Hampshire, but when I left there were 2 meters of snow on the ground. So I'm delighted to be with you all here. I wanted to share a little bit of anecdotal information here. My purpose today is to give you a sense of confidence that you did not have when you walked into this hall. Because myself and my entire team of professionals around the world have really been anointed as the gatekeepers for the quality standards that make Juice Plus the remarkable product line that it is. I want that to sink in for a minute. 42 years ago, when I was going to the University of Oklahoma, I was able to pay for some of my tuition by working in an operating room as a scrub technician. A scrub technician is the person who scrubs, who puts on the surgical gowns, who assembles all the instruments for surgery, and then provides them to the surgeon when they call for it. So a hemostat, a scalpel, a Kelly clamp, whatever. And in the 3 years that I did that, I saw so many sad things. I saw people that were sick that had no reason to be sick. I saw an entire generation of people being subjected to a form of medicine which was really addressing symptoms and not the core issues of disease. The Germans have a wonderful saying. It's called "Man isst, was isst." Man is what he eats. I come from a nation of the most overfed, undernourished people on the planet. If you don't believe me, come visit Los Angeles sometime, or New York, or Philadelphia, or Chicago. We eat more caloric intake of empty foods in America than anywhere else on planet Earth. Hence, we have what? The highest degrees of disease in the form of onset diabetes, obesity, heart disease in the modern world. So why is this? And how does this relate to Juice Plus? After I graduated from the university, I moved back to California from whence I was from. And I was given an opportunity to work in an industry that I felt was the closest thing to the frontier of modern medicine. And that is the design, the research, and the development of dietary supplements, nutritional products. Looking at the historical data from the Aboriginal writings of the American Indians, the Canadian Indians, the Aborigines of Australia, many of the pioneers in herbal medicine and other forms of medicine here in Europe as well as in Asia. And what I discovered was that there was consistently a pattern of a synergistic approach to dealing with disease. Synergy is a very important word for you to understand and take with you today. You just heard Dr. Eccles speak of the term. Synergy is where the parts, the sum of the parts, work together far better when they're administered together than if they're isolated and administered separately. In the last 35 years, I've been working in my own business, which is started in my garage in Southern California and now has very substantial garages in 3 countries. I say that tongue-in-cheek because they are far from garages. We have almost 100,000 square feet of Swissmedic-approved manufacturing that you are welcome to come visit in Lugano, Switzerland. We have almost 250,000 square feet of TGA-certified, NSF-certified facilities in San Diego County, and we're looking to expand in Asia as we speak. So, Wrap that together. What's going on in our industry? In October of last year, I was asked to keynote an address to the Codex Alimentarius Commission meeting on Import-Export Standards. It was held in Brisbane, Australia, and I assembled a team of experts to come together to talk about how dietary supplements are made, how they should be made, and what the best practices would be if you were to actually create a super regulatory scheme. I had with me in presentation some of the leading experts in the field, including one of the key regulators from the Therapeutic Goods Administration in Australia. If you don't know what that is, that's kind of like the FDA in the United States or the FSA here in the UK. And it was an extraordinary conference. And what we talked about was the need to set standards and to hold ourselves as an industry to the highest standards possible. So what does that mean? Well, in point of fact, Juice Plus is a perfect example of how it should be done. First of all, we have identified dozens, if not hundreds, of compounds found in the Juice Plus materials. You don't do that by wishful thinking. You do that by expending millions of dollars in analytical chemistry equipment, as well as hiring the best and brightest in the world of pharmacology, pharmacognosy, biology, microbiology, and phytochemistry. You assemble them together and you give them the clear charter that it is your job to find out what's in this product, why it may be beneficial, and then provide that information to Juice Plus. The important dynamic here is that long before anybody else was really doing this, the teamwork of NAI and Juice Plus was underway. 22 years ago, what started as a very interesting idea of looking for juices from fruits and vegetables and their life-giving benefits, combined with other compounds like the synergistic components that are found therein. How does that address the needs of the consumer today? For the last 20 years, the United Nations Health Organization has been talking about the need to consume 5 to 9 servings of fresh fruits and vegetables a day. I would hazard a guess that today, even though you are involved in Juice Plus or you're thinking about it, most of you have not consumed 5 to 9 servings of fresh fruits and vegetables. Show of hands. Have you consumed 5 to 9 servings today of fresh fruits and vegetables? I see 4 hands, 5 hands, 6 hands, 8 hands, maybe 20 hands. That leaves about 2,000 people who realize that even though we are admonished to do that on a daily basis, there's a certain impracticality associated with that. All right, so you take the best of research in terms of finding out what's in product, you marry it to the best practices of how you should actually make a supplement, how you should test it, how you should make it consistent, so batch to batch to batch, there is an element of consistency, and then you do one better. You go spend millions and millions of dollars doing multiple randomized clinical controlled studies. Over 30 of them have been conducted by Juice Plus. 30 randomized clinical studies. They have been subjected to peer review and published. I would venture to say that there's no other company that I'm aware of that I have the privilege of working with that has done anywhere near that level of scrutiny. What's fascinating about that is we didn't know all the things that were in Juice Plus when we started. The analytical methodology over the last 22 years has evolved into something much more sophisticated than even we had 22 years ago. We're now using gas chromatograph. We're using atomic absorption units to identify the different array of lycopenoids that are present, the alpha carotenes, the beta carotenes, the luteins, the astaxanthins, all of these compounds that you can barely speak of. I just heard Dr. Eccles speak about resveratrol. Resveratrol is a very remarkable component, but it also has subcomponents, which are also present in your product called pterostilbenes. These compounds lead to NADH management, which is an energy molecule for your body. For those of you that have never experienced the Juice Plus effect, I didn't know what that meant until I asked John Blair recently. I thought the Juice Plus effect is where you needed to be near a bathroom after the first 3 days of taking it, because many of you have experienced what I called the Juice Plus epiphany. The goose you consumed 3 weeks ago finally left, along with God knows what else. So the interesting dynamic here is long before we knew what was in there, we knew something was good. The first study that was conducted with colleagues at the University of California in Los Angeles, and it was published. It was a study that John Weiss oversaw. And John and I had a conversation with John Blair and others and said, you know, this may be something really cutting edge. Let's administer Juice Plus, and let's identify through blood studies what is the serum lipid peroxide levels before and after administration. Serum lipid peroxide is a fancy word for saying how rancid is the oil or the fat in your bloodstream. Everybody following that? To our utter amazement, we found an extraordinary benefit just after a month of taking Juice Plus. The serum lipid peroxide rates dropped precipitously, meaning that there was something going on, but we didn't understand all the pathways. To this day, we don't understand all the pathways, but we do know one thing. The synergistic effect of combining these juices from fruits and vegetables, along with their synergistic components, are at the cutting edge of what I consider to be a modern form of medicine. Let that sink in. Hippocrates wasn't far off when he said, let your food be your medicine. Most people don't quote, and let your medicine be your food. But the simple fact of the matter is, something as simple as fruits and vegetables has resonated now with millions of customers around the world. It was important to us, and we have accepted the mantle gratefully from Juice Plus, to make sure that every batch is consistent with the prior batch, that all the technologies that we have at our fingertips can be utilized at a moment's notice to identify additional compounds. Many of you didn't know, for example, that lycopene can be constructed into 1,000 different isomers of lycopene. 1,000 different isomers, slightly different configurations, whereas in nature there may only be 100 of them. So are there other benefits that are as yet untold with Juice Plus? The answer to that, I think, is definitively yes. When you're looking for the concept of credibility, I want to share with you that it's really nice when a medical journal or a journal of nutrition picks up your talk. I'm happy to report that in the European Journal of Nutrition, I think that's where we are, 2015, January, that would be last month, the article published entitled A Quality Dietary Supplement, Before You Start and After It's Marketed, a conference report, and I'm the first author. This you can get online, and I would suggest you download it and put it into your sales tools, because it's important for you to know who your partner is and the level of confidence that you should have in sharing these products with your family, with your physician, with your colleagues at work, with friends at the gym, with your fellow churchgoers, wherever you are. Because the price of health today has no real price tag. I was talking to a friend who recently had a bout with the disease, and he said, Mark, he said, you don't understand how precious your health is until you don't have it. And he said, had I known what I know now, I would have made different choices. But I can tell you, as you live and breathe and walk this earth, you're here for a purpose. And your purpose is to live as a shining example of being the best that you can be. All the tools are here. When God created this beautiful planet we call Earth, He gave us all these wonderful things, these fruits, these vegetables, these things to manage, along with our habits and our thoughts and our prayers and our attitude towards life. You never meet someone in a cemetery who tells you they'd like to come back and try doing their life again, do you? Because they can't speak. But you have a voice. We have a voice collectively. We can say, enough is enough. It's time to stop treating symptoms and start tackling the reasons why we have disease. If your food is truly going to be your medicine, you need to partner with a firm that has put their money where their mouth is by doing the clinical studies that have been conducted on Juice Plus, by recognizing that only when you subject your efforts to peer review by scientists around the world, near and far, and having that information published, can you really say unequivocally that our product has been subjected to the rigors of randomized clinical controlled testing. Show us yours. I've talked to principals of major pharmaceutical companies that are scratching their heads going, why didn't we think of this? And the reason is because for an entire generation or two, we've been admonished that when you're ill, take a pill, or go to the emergency room, or take an antibiotic. And as a consequence, what do we have? Overuse of antibiotics, overindulgence of painkillers, and a whole bunch of sick people, where they're managing their illnesses, not really helping your body cure those illnesses. The immune system is a very powerful device. The studies that have been done, you'll hear about even later today on Juice Plus, dealing with immune benefits are extraordinary. But more importantly, understand this. When I go to Geneva this year and talk to the leading regulators from around the world at the Codex Alimentarius Commission, I'm going to remind them that modern medicine as we know it has had its day in the sun. It's time for us to get back to the basics. Let's look at what got us here to start with, and let's look at a more holistic approach to managing the welfare and the health of our families, our societies, our countries, and our world. Because if we continue on the path that we have consistently been on, we will lead to failure. But if we follow the pursuits of our hearts, which is to do right in the sight of God and men, subject our work, our life's efforts, to the scrutiny of others far more intelligent than us, and let them show us any mistakes that we've made so we can correct them. That is the far better path. And I think that's the path that you would like to embark upon. Otherwise, why would you be here on a beautiful Friday afternoon in Birmingham, England? I can assure you the future is bright for those that seize this moment to understand the level of quality, the level of integrity, the level of scientific veracity that is embodied within the products that you have available for your use. I can safely state that the future for Juice Plus is not only bright, in many respects, it hasn't even started. So next time you're in San Diego, or you're in Lugano, Switzerland, make a point, check with Simon or your managers and see if you can organize a tour of our facilities. It would be our honor and our privilege to show you where some of the finest products in the world are made, particularly Juice Plus. Thank you all very much.
And it feels like I'm drowning.